Give me the clicker. Okay, thank you. Good evening, my precious friends that are coming here. You're fighting the traffic. You're fighting the desire to stay home, nice and warm, and just relax after a whole week of arduous work. But I believe there's a blessing for you tonight. And I want to talk about obesity. Obesity is a very hot topic worldwide. Thank you, Pastor. So let's just get right into it because I don't want to keep you here for too long. Let's see. Obesity worldwide epidemic. All right, so let's start with a little bit of statistics, obesity statistics. Back in the 80s, some of you, the majority of you were not even born back in the 80s. You look so young to me that I'll just tell you the history facts, okay? Just take it by faith. 1 out of 6 people in the United States had obesity, so that was actually like 12% of the population in the country. Then by 2008, 1 of 3 people had obesity, so that was about 33%. And now, this is recent information, in 7 states, obesity has actually surpassed the 1 in 3 people. Now it's 35% of the population have obesity. And what really consternates us as physicians is this right here. Child obesity is particularly worrisome. Very worrisome. And as I mentioned to you earlier, this is the first generation in the history of humanity in which parents are going to outlive their children. You're not going to see your children grow. You're eventually going to have to prepare a funeral for your children. That is a sad reality. And let's just pray that the future generations will gain wisdom and the desire to follow biblical counsel, because if we follow biblical counsel, the diet of Genesis 1:29 is not going to promote obesity at all. The leading cause of preventable death worldwide, can you tell me which one is the leading cause of preventable death worldwide? This is something you can do about it. It's a trick question. I hear you guys saying obesity because we're talking about obesity, but I got you right there. It's smoking. Yes. Let me just say something about smoking, okay? You see, back in the 50s and 60s, smoking became like one of those things that you did if you were cool, all right? Like celebrities started smoking and all that. But now in the early 2000s, now 2008, 9, 10, now we have a new trend, which is electronic cigarettes. Electronic cigarettes are like for example, pen-sized cigarettes, cylinder-shaped cigarettes that you just put a little battery. And now they sell flavors. So you want vanilla, you can have vanilla. You want strawberry, you can have strawberry, and maybe even organic flavors. And now you just put it in your mouth, and you start just inhaling it, and they advertise it as only 8 milligrams of nicotine. So children start getting these electronic cigarettes, and they give it some nice, cool names like J-U-U-L, Joel. And now you go to high schools and you tell kids, do you Joel? And they all laugh and say, yeah, I Joel. And they all carry, and parents don't even know what this language is all about. But now we have cities around Oklahoma and around different states that are just raising the alarm, the red flag, saying, stop that, because we have people that are actually dying. They don't call it smoking, they call it vaping. Just let the vapor out. Very dangerous. It's a new trend, but we're seeing that it actually damages the lungs. We're not prepared to see all that injury coming ahead, so it's good to just stay old-fashioned. And just avoid that because it's the leading cause of preventable death worldwide. And the second leading cause of preventable death worldwide is obesity. And the third one is alcohol. So U.S. school lunch can be better. We definitely can improve, all right? We had our previous ex-president Obama. His wife was she was a strong proponent of healthy school diets. Praise the Lord for that lady, Michelle Obama. And if you look, for example, the statistics, Italy actually has one of the highest life expectancies worldwide after Japan, and Switzerland is really up there because what they give to their children is very nutritious. You see, they give some very nice, organic, juicy, vitamin C rich grapes right here, and then a little bit of pasta to give you some carbohydrates, and some fish portion right here with plenty of raw, fresh greens, whole wheat bread, and your salad. We can't forego the salad. Compare that to the typical standard American diet. You have your chicken nuggets. You have to dip it in your ketchup, and your mashed potatoes, favorite vegetables among kids, mashed potatoes right here. And then your big cookie right here. That cookie is almost about to fall off. It's so big. And then you have your chickpeas, and then this little jello thing. So this is nothing but sugar on top of sugar. A lot of carbohydrates. That puts you on the fast track for diabetes. Where is my fresh fruit? I don't see it. So obesity alters the social environment as well. When you have obesity, rules change in your community. You see, there are some insurance companies that they charge you based on your waist size. Okay, they ask you to fill out this form or just tell me over the phone, what is your BMI? What is your BMI? Because it's just like your insurance for your car. If you have a Ferrari, that bill is going to go up. If I have a little Ford Focus, I'm going to pay a small, because they say, it's a Ford Focus, a little Toyota Corolla. He's not going to go racing, come on. But if he has a Corvette or something, then the bill is going to go up. And these insurance companies, they use BMI. If your BMI is high in the overweight range, which is 25 to 29, then that insurance agent is going to say, this guy is prone to surgeries. He's about to have diabetes and very prone to heart attacks, so I'm going to have to crank up the bill for him. I don't know if we have any more prizes, but whoever answers this question deserves a big prize, okay? You ready for this? Ready for this question? Okay, so I told you during the week that normal BMI, and those watching online actually can't participate. You can just tweet the answer, or you can put it in YouTube. The normal BMI is 18.5 to 24, okay? 24.5. That's normal. Normal NL means normal BMI. And then overweight this is overweight. Overweight BMI starts from 25 to 29. Obesity starts from 30 to 34, all right? Obesity class 1. The question is this: why do we start overweight range at 25 BMI? Do you think some doctors were just having coffee and all of a sudden they say, you know what, where do we start the cutoff line of overweight? Do you like 25? Yeah, let's just go for 25. Yeah, of course. Let's cheers, 25. All say 25. Okay, so overweight, let's just say, take of hands, 25. So they started with 25. Do you think it just happened randomly and casually like that? Or do you think there's a reason behind it? Why do you think that is? Thank you, Pastor. Why do we start the overweight cutoff range at 25 BMI? That's the question. Big $1 million question. You're getting close. You're getting close. But it's so simple. 2, 3, okay, go. You're going into adulthood? Okay, that's a good guess. That's a good guess. Yes, absolutely. You probably ate some blueberries because you're getting creative on me. Answer is I think we're going to have to keep the big $1 million prize for tomorrow, Pastor. But the answer is check this out. Next time you go to see your doctor, ask him that question. It's a really, really good question. And doctors don't even know, okay? And I mean, this, if you know, you learn something. The reason why we start with 25 as overweight BMI is because at 25, mortality rate increases. That's when we start seeing people dying, 25 BMI. So we said, hey, that's where you start overweight, when people start dying. So that's why. It has a reason. There's always a reason behind it, all right? So if we go ahead, insurance is going to charge you more. There is people that go to the stores, they go to the mall to look for their pants, and they don't see their pant size anymore. And they sue companies. There's this company called Abercrombie & Fish. It got sued because they're not selling extra large anymore. True story. And some air flight companies, they're actually mad because some people are taking 2 seats in the airplane. 2 seats. So they don't know if they should charge you twice or they should tell another passenger to just move to the back or something. So this is altering the way society is functioning. So we're not prepared to see this uproaring of obesity and all the lawsuits and everything. So in terms of ethnicity and races, okay, people who are more predisposed to obesity, we start with Hispanics right here, and then we move to people of color, African Americans, even Caribbeans. These are in this category right here. So we need to take care of our bodies. We have the predisposition, genetic predisposition to become overweight. And the same goes with diabetes. Hispanics and people that belong to African American descendants. And the same goes with diseases such as metabolic syndrome, okay, which is basically a constellation of overweight, high blood sugar, high triglycerides, high cholesterol, and high blood pressure. So now obesity worldwide, as you see, the red is where you have more than 60% overweight, and right here in North America, we have a lot of that, starting with Mexico and with the United States and Canada right here. And much of this is because of the fast food industry. And I appreciate the fact that a lot of these fast food restaurants are throwing some vegetables. You go to Denny's, for example, you'll see some good vegetables. McDonald's is including some good vegetables, Burger King as well. But the reality is that people don't choose always the vegetables. They choose what's more fatty and cheesy and more like fried food. So we have to educate our palate or taste buds, okay? All right, so 1 in 5 children is going to have to inject himself because of diabetes. 1 in 5 children will have to inject himself insulin because of diabetes, and that's not good. Children with obesity at 6 years of age are more likely to be obese for the rest of their life. A lot of parents and grandparents and uncles and aunts, they see their nephews and nieces and when they're small, and they're like, you know what, my kid, you have to start eating. Come on, eat, get big. If you don't get big, you're not going to be healthy. But there's a problem. If your little boy starts to be obese, by the time he is 6 years of age, there's an 80% chance he's going to be obese for the rest of his life. You do not want to see obesity in children. You want him to be nice and fit, because if he goes over 6 having obesity, he's going to battle with obesity for the rest of his life, all right? So some parents are afraid of giving their children plant-based diets because they say, oh, if I give plant-based diets to my children, he's just not going to grow. You know, they did a study in Loma Linda School of Medicine, and vegetarian children grow 1 inch in length more than children that eat meat. So they're a little taller. If you eat animal products, you're going to grow, but to your size. If you eat more vegetables, you're going to grow vertically. So that's actually more attractive. It's a better trait for you. Teen girls who drink cow's milk start menstruating up to 2 years earlier. They found out, some researchers in Chile, down in South America. So check this out. We saw that girls that drink cow's milk, when they are 8, 9, 10 years of age, they start menstruating earlier, 2 years earlier than girls that don't drink the cow's milk. And you say, what is the implication of that? Why are you so worried about that, Dr. Eloy? Well, milk introduces anabolic hormones, which is called estrogen, into your body. Increasing estrogen increases the risk of estrogen-sensitive cancers. In women, that would be breast cancer and uterine cancer, which is adenocarcinoma of the uterus. Men, high levels of estrogen, that's going to enlarge your prostate. So you don't want to overload yourself with estrogen. The advice I can give you is go slow with cow's milk and start plant-based milk, like almond milk, for example. Soy milk if you don't have thyroid issues, because if you have thyroid issues, you want to avoid everything that slows the function of your thyroid. What are those things? Goitrogens. Goitrogens are things that make your thyroid get goiters. What is that? Becomes inflamed. You have nodules, you have masses, it becomes very enlarged. It's called thyroid megaly. So things such as broccoli, things such as spinach, such as cabbage, such as Brussels sprouts and soy, and some things such as, for example, alfalfa, they can, and watercress, they can suppress the function of your thyroid, and we don't want that because you're going to end up having hypothyroidism. But in this concern, what you want to do is you want to look more for plant-based milk instead of animal milk. And some people have asked me the question, how about goat's milk? Because goats, they tend to feed more on grass. They're not that fatty. And let me tell you, milk from goats has high levels of tyrosine. That's good for your thyroid. Tyrosine produces norepinephrine, gives you energy, helps you think. And goat's milk also has zinc, which is good for the prostate. It's good for your nails, for your skin, for your immune system. But it has 20 milligrams of cholesterol. So if you want to drink goat's milk, it's okay, but if you start drinking goat's milk and then you eat your regular eggs and then you eat your beef and your milk and your chicken, you're loading yourself with cholesterol. And you're not going to sweat cholesterol. Cholesterol stays in your liver, okay? You're not going to pee cholesterol. Cholesterol stays in your arteries and the arteries of your brain. That's why the third leading cause of death is cholesterol in the brain builds up plaques and causes occlusions, blockage. It's called stroke. Very dangerous. So you want to go slow on the cholesterol as well. Now, to measure obesity, we use this little table called BMI table. It's very simple. You just look at your weight and then you compare that with your height, and that gives you your BMI. And I have here the scales, the underweight, the normal, the overweight, obesity, and morbid obesity. Morbid obesity means that you're seriously about to have a heart attack. You're seriously about to have a diagnosis of cancer, and obviously you have diabetes, diagnosed diabetes. And if you have obesity at this range, there is aggressive treatment for you. And there's something called bariatric surgery, which is they cut half of your stomach, one portion of your stomach, so you don't eat as much. Okay, that has its complications, but it also has good rates of clinical remission in several diseases. So let's pick some people, and I'll give you your BMI right now. So who knows your weight in pounds, and who knows your height? My good friend Rodness. Okay, so what is your? Let's start with your height. How tall are you, Rodness? 6'3"? Oh, 6 feet. Okay, so you're right here, 6 feet. And how much do you weigh in pounds? 200. So you're right here. You're right here. So your BMI is 27. 27. If we put a 27 on the scale, that would be overweight. Overweight. Now, I will explain something about Rodness. Rodness is a very special case. Somebody else that wants to know his or her BMI? Yes, my good friend. How tall are you? 5'7". So you are right over here. 5'7", you're right over here. And 150 pounds. Okay, so you're right here. You're 24, between 24 and 23. So you're actually in the normal BMI range. Congratulations. I can see you're already using that little ball you won, right? I saw you using it in the pew. Okay, that got you right on your tracks, okay? Now, this is the thing. If you look at Rodness, he does not look very, very big, right? He looks normal. So this has limitations because BMI measures your weight, and your weight can come from two flavors. It can be fat or it can be muscle. Both of those add to your weight. All right, so we have a very muscular individual. He's going to give me a very big BMI, but he has no fat. He's pure muscle. So there is a little bit of discrepancy, and that's what happened with Rodness. He gave me an overweight BMI, but he does not look overweight. So what we do in medicine, we measure waist circumference, and this is more accurate than BMI because now we take into account just the fat and not the muscle. Okay? So what we do is we measure your waist, and we divide that by your hip right here. And if that is waist-hip ratio greater than 0.9 in women, and in men is greater than 1.0 in men, okay, that increases your risk of diabetes, high blood pressure, cancer, and heart disease. Let me just put it to you in simple language. If you get a measuring tape, just like this one, and if you measure your waist, and if it's greater than or equal to 102 centimeters in men, you have high risk of cancer, diabetes, high blood pressure, and heart disease. In women, if your waist is equal to or greater than 88 centimeters in diameter, same thing for you. So as simple as just getting a measuring tape and measuring your waist, all right? We measure the waist because fat accumulation in your belly is the most dangerous disease-promoting fat. Now, this individual also has this condition. He has abnormal female-like breast tissue in his chest. I gave you a clinical name for that. What was that name? Gynecomastia, correct. Exactly. Good job, Dill. Now, if you look at his chin right here, it's extremely puffy and swollen. So obviously, he is in trouble. I want to talk a little bit more about that as we progress. So a healthy individual, you can just look at a person, you can say, you're healthy, or you're in big trouble. Go see Dr. Eloy quickly, all right? All right, so if you have an individual whose chest is greater than his belly, good job. You're on your way to good health, long, productive years. But if you have an individual whose belly is way bigger than his or her chest, oh no, bad deal. So you want the triangle to look pointing down, then pointing up. I want to see the triangles in the people. Can you please stand up so I can? No, I'm just, okay. See, Pastor is really proud of his muscular figure, his six-pack, so he's just becoming our example. He has the triangle pointing down, so good for you, Pastor Nathan. There you go. You have to give us a recipe. A lot of Big Franks, or what's your recipe? So balance. There you go. Nice. So that's what you want. You want to make sure that your triangle is pointing down, is not pointing up, okay? Now, let me just talk to you about food timing, because food timing is extremely important. In Japan right now, according to the World Health Organization, in the last 3 years, they have the longest living individuals. These people live over 100 years, except a community of Japanese individuals called sumo wrestlers. Sumo wrestlers were born slim because they have the Japanese genotype. That means they have the genetic composition to be nice and slim. And this individual just started his sumo wrestling career. As you can see, he has muscle tone. He is very nice and fit. At the beginning of his wrestling career, they are nice and muscular. So what causes them to gain weight? That is the question. See, sumo wrestling is not like boxing. Boxing, they have to weight you on the scale against your opponent, and they have to have certain weights so you can fight each other. Wrestling is not like that. Sumo wrestling is different. There's no weight limitations. All you have to do is you have to get really big and push your enemy outside a circle, and you win. So it's to your advantage if you have a lot of volume, all right? So these people want to get really big. So what do they do to get big? They go to the gym on an empty stomach. They wake up and they don't have breakfast. That's a big mistake. When you don't have breakfast, and that's the reason why it's called breakfast, because you're breaking a long fast during the night because you were asleep during the night for 8 hours or maybe more. Okay? So do you go to the morning? You go to the gym in the morning on an empty stomach, and that puts a lot of stress on his thyroid. Thyroid is the hormone right here on his neck, butterfly shaped, that regulates temperature, energy, and also regulates protein synthesis. So this individual, or any individual in this room who decides not to have breakfast, just put his thyroid, his pancreas, his endocrine glands under a lot of stress, and the thalamus starts to communicate, which is the master hormone, master gland, communicates with the body and says, you know what, did you receive breakfast? And then the pancreas says no. And then the thalamus says, okay, so we're going through a famine, no food. So the next meal that we intake, we're going to not burn it in metabolic energy. We're going to accumulate it as fat. Okay, so all the glands get together and they agree. And next time they have a meal is at 2 p.m. That's their first meal of the day. Then they take a big nap. And their last meal is at 10 p.m. And they go straight to bed. The majority of the things they eat is pasta, white rice, carbohydrates. When they do this every day, 400 pounds. I have a lot of friends and patients and acquaintances that they come to me and they say, you know what? I'm eating very small portions and I'm gaining weight. What is going on? Are you having breakfast? No. That's the reason why. They thought that skipping one meal was going to reduce their calories, and that was going to result in weight loss. That was actually very, very detrimental. So these people are not allowed by Japanese governmental rules, are not allowed to drive, because if they drive, they eventually can get in a car accident, and seat belts do not click. They're too big that they cannot wrap the seatbelt around their bodies, so they're not allowed to drive. And sumo wrestlers, on average, eat 10,000 calories per day. Now, there's two types of fat, okay? Two types of fat. and that is subcutaneous fat, and that is the fat that I can see and I can touch, and that is the fat that is outside the muscle, outside the rectus abdominis. If you take your shirt off, whatever I see right here, that's subcutaneous fat. But also there is the fat around your heart, around your liver, around your intestines, and that is called visceral fat, and that is invisible. Invisible. I can be full of fat myself, even though I'm slim, but it's all visceral fat. My question to you is, which of the two is more harmful for your health? So Betty is saying visceral. Who goes with Betty? Dill goes with Betty. Okay, Betty, you're the winner. Visceral fat is way more harmful. This is the fat that envelopes the heart and clogs the arteries and creates more inflammation. Very dangerous. Here you're seeing a magnetic image of a real man that has obesity. I want you to take a look at his liver. His liver is extremely big. Swollen liver right here is so big that it's pushing onto his lungs right here. These black things you see right here, these are the lungs. No wonder obese people with obesity cannot breathe. Have you seen people with obesity, how they breathe? They feel like they're about to choke. Because all this liver enlargement is compressing their lungs to the point that they cannot fill their lungs with oxygen, and they have shortness of breath. The heart is in compromise too. And also take a look right here. You can see a lot of fat tissue hanging here. Take a look at the knees. This bone is rubbing on this other bone. There is no cartilage in between to cushion the bones. No wonder people with obesity, they walk like this. Osteoarthritis of the knee. Very, very bad news. So, you think we should give him a painkiller for his osteoarthritis of the knee and just send him home? Very bad service. You got to have this individual lose weight immediately, otherwise his knees are going to fail completely. He has a little bit of cartilage right here, as you can see, this little sandwich-like structure here is in between the bones. That's cartilage, but on this other side, he has no cartilage. That's why he is in very profound pain. Now remember that one fat cell produces harmful hormones. TNF, tumor necrosis factor alpha, that is going to destroy your cartilage. IL-6 is going to destroy your bones, decalcification of your bones. Fatty acids are going to clog your arteries and your liver. And this buddy right here, resistant, is going to cause resistance of insulin and sugar. It's going to cause diabetes type 2. You do not want this. That's bad news. Also, this one right here causes thickening of the blood. That's why people that have obesity, their blood is like this. It's just stacking one red blood cell on top of another. It's just a big clogging up of the blood cells, instead of the blood cells just floating freely and creating oxygen and all around the tissues. So this is normal, this is abnormal. That's why it's really hard to think when you have a lot of obesity, because blood flow is not getting to the brain. All of a sudden you have eye pain because blood flow is not getting to the retina. You have occlusions, blood clots in your retinal arteries. So that's a bad deal right there. So now we have a little bit of acanthosis nigricans. This is actually a sign your skin is telling you that you have to do something immediately, because this is diabetes type 2, insulin resistance. And this is not dirt. This is not going to go away with bleaching agents, with scrubbing your skin. You can see little things right here just popping up. This is skin tags. This is diabetes type 2. It's just your body telling you your metabolism is out of whack. There's a big problem. Do something about it. Now, this study right here is called a thermogram study. and it just measures all the inflammation around your body. Things that are red are things that are inflamed. Red areas reveal heat and inflammation. As you can see, this poor lady with obesity, she has very inflamed face. So she has a lot of pain right here, beneath her breast, around her waist, and in her back. That's why a lot of people with obesity complain of back problems. Oh no. I saw this lady today, and I told her, can you please do this? And as soon as she tried to do that arc without bending her knees, she screamed. She was in a lot of pain because this is a lumbosacral pain right here. There are discs that get protruded. That's called herniation of the disc, radiculopathy. It compresses the nerves that are coming out of these spinal nerves, and that creates a lot of pain all around your leg. Now check out her feet. Her feet are blue because she's getting no blood flow in her feet. If she were to get a cut or an ulcer, if she has diabetes, that's not going to heal. Very dangerous. So obesity is not a good trait. You don't want obesity in your life. Obesity shortens lifespan by approximately 3 to 5 years if your obesity is right here. If your obesity is about right here, if you have overweight and then you go into obesity, you can lose up to 5 years. But if you're young, let's say in your 30s and your 20s, and if you're right here above 30, getting to 34 and maybe to 40, okay, above 45, then you're going to lose 13 years of your lifespan. So this is very important that you take into account the fact that diabetes makes you a bad steward, because the Lord wants to use you many years in His service. He wants to bless you many years. And if I have diabetes, or if I have high blood pressure or obesity, years can be shortened. So I have to say to the Lord, Father, help me. I want to be a good steward and take care of the body that you gave me so you can use me for eternity, here and later. And then the Lord is going to honor that request. He's going to honor that request. If you're willing to make changes, there is grace and there is restoration. There is something called atherosclerosis. When you have obesity, these fat cells produce what hormone that clogs your arteries? Or what substance? Fatty acids. Remember right here, fatty acids are secreted from your fat cells. Where do these fatty acids go? You're seeing in the screen. They go right here to your arteries in your heart, and they form, this is fatty acid. It came directly from your fat tissue. It's forming this atherosclerosis plaque right here. Oh, the first manifestation, when it's 50% blocked, you don't feel a thing. No symptoms. When it's 70% blocked, then you have chest pain, especially when you go upstairs. When you walk long distances, you start having shortness of breath, numbness in your arm, your jaw starts to hurt as well, and that is actually signs and symptoms you're about to have a heart attack. Angina means chest pain. All right? And another thing that happens when you have obesity is that you have breast cancer risk. Fat cells have an enzyme called aromatase. So in your fat cells, you have aromatase, and aromatase is going to do a conversion that you're not going to like. It's going to take your muscle hormone, testosterone, it's going to convert it to your cancer-promoting hormone, estrogen, and high levels of estrogen are going to promote cancer of the breast. So that's why ladies that have obesity have high risk of breast cancer. Now, let me just say this. Can men have breast cancer? Yes or no? For every 150 women in the United States that have breast cancer, 1 man is going to have breast cancer. Yes, men can also have breast cancer. Betty, you're on fire tonight. I think you read my presentation before I came here or something. Okay, now, fat deposition in the neck, right here in the neck, impairs sleep. Fat deposition in your neck when you put yourself supine position, meaning your head is going to be up. What's going to happen is that fat is going to push on the airways, your muscles in your throat. That's called the pharyngeal muscles, and that's going to cause obstruction, and that's called obstructive sleep apnea. And your partner is not going to like that because she has to wake up early tomorrow to go to work. So that is actually a serious condition. So for that, we need to do a sleep study. It's called polysomnography. And then that sleep study is going to show that you wake up multiple times, unable to breathe, so cessation of breathing. And the first line treatment is lose weight immediately. The second line treatment is they give you this machine called CPAP, okay? Continuous positive airway pressure, CPAP. That is going to try to open up your airways so that they don't collapse. And if that does not work, then there is surgery. They just open up your airways so that you can breathe better. All right? And we are advancing here. Now, when we have obesity, the stomach is not able to close right here. Closure of the stomach right here is going to prevent all this yellow stuff, which is the acid from your food and the acid that your stomach produces. If you don't close this little lock called sphincter, then all this is going to return up to the esophagus. It's going to burn this esophageal wall. It's going to hurt. We call that heartburn. 1 or 2 episodes do nothing. But if you have heartburn for 10 years, it may turn into esophageal cancer, cancer of the esophagus, okay? People that have obesity open up this little lock right here, and this becomes relaxed and open, and all the acid begins to return. That's called reflux disease. Anti-acid is not the smartest choice. The smartest choice is losing weight. People in China get esophageal cancer. The top part of the esophagus gets cancer in China. Why is that? They eat fermented foods. What's in a fermented food? Alcohol. Alcohol damages the top part of your esophagus. The esophagus, this tube right here is your feeding tube that connects your mouth with your stomach, is 19 centimeters. At the very top, if you ingest alcohol or nicotine, you're going to have cancer. Squamous cell carcinoma up there of the esophagus, about right here. But if you have obesity, and if you have continuous reflux, then you're going to have cancer of the lower esophagus right here, the bottom portion, and that's called adenocarcinoma of the esophagus. That's very, very painful. Very, very painful. So it's lifestyle medicine. Up here, alcohol. Down here, acid due to obesity. You have the answer. You can make something to decrease that detrimental effect, all right? So as we move along, complications of obesity, stroke, that's very painful. I have spoke to several people around here that have gone through a stroke, and let me remind you that 90% of people that have a stroke cannot move like before. They can't go back to work. They become forever impaired. How do you know you're about to have a stroke? Let me give you a little wisdom right here. How do you know you're about to have a stroke? Facial drooping. Your face starts to drop. Your lip, like this. Okay? And then arm weakness. Honey, for some reason I cannot raise my arms. All right? Speech impairment. Your tongue just kind of gets stuck, and is just unable to create words. That's called dysarthria. You just kind of have your tongue stuck to your heart plate and you just go like this, you want to say a word, but you can't because your tongue is not receiving blood flow, all right? And there, the area of your brain that is in charge of language and vocabulary is impaired because it has an occlusion. There's a cholesterol plaque, and the T stands for time to call 911. Time to call 911. Fast. And you call that fast. Prevent a stroke. And when you get to the hospital, if this is a good hospital, they give you something through your body, through your vein, to destroy the clot. And then you're able to function normally. But if you take too long, there might be permanent damage, okay? So, blood vessel damage, hypertension, type 2 diabetes, kidney failure. Oh, we don't want that, kidney failure. Now, you're seeing right here an image of a real knee joint. And as you can see, cartilage is not seen on an x-ray. Cartilage, you don't see it on an x-ray. So this right here is cartilage. And as you can see, cartilage is a gummy substance full of water and cartilaginous substance that keeps the bones from hitting each other, and that's good. But over here, there is no cartilage, and now the bones are rubbing against each other, and that creates a lot of pain. And if I tell the patient, can you please flex your knee, I'm going to hear rick, rock, rick, rock, rick. It's a squeaky sound. It's called crepitus. That is osteoarthritis of the knee joint. Right here. So you want to see something like this. There's a space separating the knee, but if you don't see it, that is actually accelerated osteoarthritis of the knee because of excessive weight. All right, so solution. We're getting to the final part. The solution is, the first thing you want to do is you have to walk 150 minutes per week. And if you want to start slow because you don't want to do high impact exercises. You want to start swimming, you want to start using a trampoline, or you want to start walking, okay? This is low impact activities. This lady is actually jogging in the beach, and when you jog in the sand, then that is actually more comfortable for your lower back. It's not going to create back problems. All right, so you can do any of these or just do some walking. That's just as good. And remember that the quality of your breakfast determines the health of your day. I showed you this before. If you start with a very low fiber, high sugary, high carbohydrate cereal, you're going to start your day with a lot of sugar, and by the time it's 11, 12 at noon, you're going to have a you're going to nosedive into a very hypoglycemic, meaning low sugar state, and then you're going to start shaking, you're going to start having mood changes, and if it goes really, really low, you may actually faint. And that's not good, because the first cells that die when there's low blood sugar are brain cells, and those do not come back very easily. Okay, so you want to have a breakfast that is actually high in fiber, is rich in nuts, and it's more low in sugar, actually, carbohydrates. So the second thing you want to do, and somebody tell me why you want to start with breakfast. Because you don't want to turn into a sumo wrestler as simple as that. Okay, you don't want to turn into a sumo wrestler. If you don't have your breakfast, you're going to gain weight. That's just the reality. That's the way hormones work. Increase your fiber intake. You have to reach more than 30 grams of fiber per day. That is going to help you avoid colon cancer. And another thing that fiber does is that when you ingest fiber right before you eat, let's say I put some fiber into this bottle, I shake it up, and I drink my scoop of fiber right before I have my lunch or my dinner. What's going to happen? That fiber reaches your stomach, and it swells up with the water and pushes against the stomach wall. And when you push the stomach wall, you actually activate a hormone in your brain that tells yourself, I am full. No more food. That's called early satiety. early sense of fullness. So you don't have a tendency to overeat. People that eat fiber, these people actually lose weight faster. And the name of that hormone is called CCK, cystokinin, okay? Cholecystokinin. CCK is very smart hormone. Mediterranean diet is another option to start losing weight, because this diet does not promote weight gain. Full of nuts, full of beans, a lot of legumes and spices, and blueberries, pomegranate. This is delicious and good for your body, full of antioxidants. And your fish twice or 3 times a week. It's phenomenal. If you go to the International Journal of Clinical Medicine, you click on June 28, you're going to see my article that I published, and I talk about how I gave this to 67 ladies in Washington, and they dropped 2.8 units of BMI in 8 weeks. That was statistically and clinically significant. That's why I got it published, thank God. American Heart Association now recommends fish oil to lower triglycerides. What are triglycerides? Fat cells are full of triglycerides. You want to lower your fat cells? Well, take some fish oil right there, 4,000 milligrams per day of omega. EPA works at the level of the blood. This is kind of like a blood thinner type of thing. And DHA, this works at the level of your eye, at the retina. It helps to improve vision, helps in your brain, all right? Helps your joints. It has some anti-inflammatory activity. Even the textbook of cardiology, which is called Hertz Cardiology, they also advocate for the usage of omega-3 supplements. Now, also take your vitamin B complex every morning with breakfast, because this speeds up metabolism, makes your cells burn energy so that you don't accumulate more fat and start gaining weight. So you want your B complex to say B50, that means 50 milligrams and all the B complex vitamins, or B100 if you're really going to be active and you want to have more vitamins in your brain and in your metabolism, all right? So that's a bad idea to burn fat. This individual, he asked his doctor how to burn fat, and he tried to light up a fireplace and burn all the fat that he ate the night before. Bad idea. Bad idea, okay? So don't get any creative ideas from this individual, all right? Now, the secret to lose fat, secret to remove fat. A lot of people say, oh, doctor, tell me the secret to remove fat. Let me tell you that if you use lemon and sodium bicarbonate, you're going to successfully remove fat, okay? But you're going to remove fat from your kitchen pan, all right? So don't get so excited. All right, so don't try to remove fat from your body. There is no easy formula. You have to exercise, you have to eat healthy, you have to move, and you have to actually take more fiber and take your B vitamins. That's what you have to do. Any questions? I think we're done with this, all right? Any questions? All right, I think we're going to stop right there, my friend Jack, because it's been a long day and long week for all of these precious attendees, so we're not going to abuse their time. If there are no questions, tomorrow is the last day, right, Pastor? 2 topics tomorrow, okay.
We'll discuss with the church what time they want the one in the afternoon, because sometimes if we leave after potluck, we probably won't get you back. So we'll ask the church, and if they want to do it right after potluck, he'll have his last topic, right after potluck, okay? So that would be about maybe 2 o'clock, okay? So we don't want to do it in the evening, because it's probably going to be hard to get people to come back in the evening. So we'll ask the church. What do you think, Stuart? I think it's good to listen to the church tomorrow. So, and of course, we'll ask the church to give us their opinion, but only those that are going to come. If you're not going to come, don't even give your opinion. You know, I don't know why people do that. They give their opinion and then they don't show up. So only those that are going to show up can give their opinion. Okay? So yeah, we've had a great time. It's been a blessing. So tomorrow we have 2 more topics. We have one in the morning and one in the mid-afternoon, more likely. So 3 p.m. Okay? So yeah, we'll present that to the church, and we just want to make sure that people stay around and can enjoy the last topic. So we're just so grateful for everything that God has done so far. And so let's stand up and give him thanks. Let's thank God for his blessings. Dear God, once again, thank you so much for what we have learned. And more than that, Lord, thank you for your Holy Spirit that can give us the power and the decision to put into practice what we have learned. We want you, Lord, to help us to make the changes that we need so that not only our life can be longer, but it can be well lived. So God, please bless us. Bless us as we go home. Have us get a good night's rest and come back tomorrow. We ask it in Jesus' name. Amen. God bless you, and we'll see you tomorrow.